so that people from the Puerto Rican Hispanic neighborhood in California and Milwaukee are supposed to go to Lawndale by public transportation without transfers because they're uninsured. And the city's commitment was primarily to continue to serve the uninsured. They were going to keep that safety net going. But by doing this, they're just throwing people out into an unsafe world of unknowns and breaking relationships and just really disconnecting people all over the place. And these are people who have had relationships for years, many of them. It's really very, very critically harmful to the system and to the people involved. And I can't believe that the city would let go of its safety net of really providing available care to anybody who needs it. And that's what the city has a history of doing. And suddenly they're throwing that away.
They had gave us, the mayor, they came up with Rosen's estate. Rosen was never meant to be closed. They gave all them grasses to Carl Bell. They gave Woodlawn to UIC. We will not accept those terms. We want all 12 centers open. We will not accept nothing no more. We want black therapists, male therapists to come into the clinic. We want them fully staffed. These is our demand, fully staffed. When the therapists retire, we want them to replace them. We want more doctors, black therapists. When the men come out of incarceration, they cannot relate to a white woman, a black woman. They need a black male. A black male is no more about to deal with them than anything. So I'm asking you, please, Mayor Emanuel, please help us. Give us our rights.
Madonna Reingold has been a social worker in the system, and she was a volunteer on the mental health board for that clinic for many, many years. She is also a part of the transition team for the mental health clinics, and she's going to tell you exactly what was happening.
But also, to add on, we know that there's already been people falling through the cracks. We know from the Northwest closure, at least 15 people have been hospitalized since that from breakdowns because of the interruptions of their connections with their center. And we don't know how many are flooding the emergency rooms because their appointments are getting mucked up. We just don't know. And we are calling on the city to really track the people that are getting home.
Yes.
And they're not tracking the people that are coming and being turned away. Northwest was getting calls at the rate of 100 a month that they could not accept because they were closing. New people. And that's the demand is out there, and there's nowhere for people to come to, especially people who don't have Medicaid or other insurance.
Now yes, Paul is a part of the Illinois Nurses Association, and they are the group that all of those nurses, the FEMA-trained nurses, are going to be fired. And those public health clinics are going to be privatized. So he's going to give you an update on what's happening with that.
Hi, my name is Paul Napier. I'm a representative of the Illinois Nurses Association. We represent the nurses that work in Chicago's public neighborhood health clinics. There are 7 of those clinics. As part of this plan, Rahm Emanuel plans on shuttering the neighborhood health clinics, all 7 of them. And as such, he plans on laying off all of the nurses that work in those clinics. We've seen that there is an inseparable link between mental health care and primary health care. Our nurses go into the community, into people's homes to work with them, and they are identifying people who are in need of mental health services. Yet the mayor plans on separating this and throwing these nurses out onto the street. That's where he wants our mental health consumers to be. That's where he wants nurses to be. So the Illinois Nurses Association is standing here in defense of a public health infrastructure. We fought for many, many years to establish a public health infrastructure in Chicago. And in fact, the Chicago region once had one of the finest public health traditions in the entire country. But meanwhile, while President Obama is seeking to expand access to affordable health care for Americans, his boy, Rahm Emanuel, is back here in Chicago, throwing nurses on the street, throwing mental health consumers on the street, throwing all low-income health consumers out of their clinics and into the street, reducing their access to care. And we are not going to stand for that to happen. The full force of labor is behind this, as well as the full force of the community on this.
One of the clinics that's scheduled to close today is Marty Luckett. She's been attending that clinic for a number of years, and she wants to give her testimony. She's been very shy, but she's been very courageous for the last 3 years that she's been working with us to keep all 12 clinics open and public.
Thank you. Hi, my name is Marty Luckett. I am a consumer at the Beverly Morgan Park Clinic, and I've been going there for about 14 years. When I first came there, I was non-functioning. I couldn't, it was all I could do to get to the clinic appointments. I wasn't able to make all of them. But my therapist was just wonderful. She took me down to Social Security and helped me to sign up for disability because I couldn't do it by myself. She helped me to sign up for Link. She helped me to sign up for Medicaid and Medicare. She helped me to be able to live because I had nothing. The Beverly Morgan Park Clinic has continued that excellent tradition of care. I've become more and more functioning. I have become more and more able to, well, as I said, function by myself. And it's due to the fine work there. Now, the closure of the clinics is very frightening to me. It's down the street a few blocks from me. I walk there, or I take the train there. And now, my therapist, who, thank heaven, is still being employed, has been transferred to a clinic that's 2 hours away by rapid transit for me. 2 hours, 3 transfers. That may not sound like much to you, but I'm poor. Each one of these bus rides and transfers is money out of my pocket. Each one of these hours is a hard one for me to go through. It's hard to get out of my house sometimes. And making it to the clinic, I just don't need it to be harder. We're asking you, Rahm Emanuel, we're asking you, President Obama, we're asking you, Governor Quinn, to please save our clinics. We need them. I individually, my fellow people at the clinics, and people around the state, around the country, around the world. We all need help. Thank you.
My name is Calvin McLeod. That's CALVINMCCLOUD. Mayor Emanuel, I'm speaking to you as a man who grew up on disability, who always have been sick. And the mental health centers have been a beacon, a star in the night when I couldn't think well, or I couldn't do things well. The mental health center have helped me get on my feet, and SSI and disability have helped me go through operation after operation that I am a whole person now. I am calling on the mayor, the president, anybody to save these centers, because when you down and you think you down for the count, and just a counselor hand you a cup of coffee, that's like a man handing you $1 million. And I'm talking about a counselor at Woodline. I'm not going to say his name. Well, his name is Mr. Gilmore. I can tell you that because he retired. But I'm telling you, this is not going to work, this privatization, because I'm in a privatization clinic now, and it looks like 1968. I mean, people walking around with nothing to do, clothes ain't been washed, shoes ain't been cleaned, feet is filthy. Now, how can you put that next to a center that's well kept? Thank you very much.
Hi, I'm Kelly. I'm with Occupy Rogers Park and Occupy Chicago. Today, Occupy Rogers Park and Occupy the South Side delivered a letter to the governor's office expressing our disappointment in his failure to support the most vulnerable members of our community. These clinic closures will adversely affect a large number of mentally ill individuals in this city. This will result in further incarcerations, hospitalizations, active addictions, and suicides in this city. Virtually everyone we all know is affected in some way by mental illness. I personally lost a very good friend this past summer who committed suicide due to severe depression. We're all at risk of losing people who really matter to us because of a failure to provide services to those most in need. This is a time when we need more care, not less. We have veterans coming home, emotionally damaged by war. We have an economy that is leaving people without homes, leaving people in despair. And we have a higher rate of depression and manic depression than was ever realized in this country. Every day we have studies coming out telling us as much. I was told by an alderman this past week that the therapists of these patients never should have allowed them to speak publicly about their illnesses. When I asked him, does that mean that you feel the First Amendment rights of the mentally ill should be suppressed? He said, no, that's not what I'm saying. The media never should have published their faces. It's like, so the media should be suppressing the First Amendment rights of the mentally ill. The government doesn't want to acknowledge that people suffering from mental illness have the right to advocate for themselves. The fact is, our elected officials have failed to advocate for them. These people have been left with no choice other than to take to the streets, to chant, to carry signs, to barricade themselves inside clinics. That is not their failing. It is the failing of the people who've been elected to serve them. It is the failing of people who are supposed to protect them. So we're all here today to stand in solidarity with those who our elected officials would leave behind, those who they would leave to suffer. We are unwilling to allow that suffering to happen, and we will stand together and hold these leaders accountable until they take action to right this terrible wrong. Thank you.
Hi, good afternoon. Good afternoon, everyone. My name is Sophia Korchmar, Kortchmar. I am standing here in solidarity with the mental health movement. I got involved in this movement many months ago when it was in its first stages. We were still trying to work within the process of the city. We're still open to working within the process of the city. They have refused to work with us. We have tried, we have contacted all 50 aldermen. We have gone to city council meetings. We have asked for their attendance at town halls and things that we have organized. We have produced a 20-page report of what we thought would be the probable causes of these clinics closing. And we know now that we were right. We are starting to see already the devastating effects of closing these clinics. More than 15 people have been hospitalized just since the closing of the first clinics. We see many people who are being turned away. We see people who are being incarcerated. We see people in situations where with the police don't know how to deal with mental illness. Someone was saying to us the other day at the Woodlawn Health Clinic that already people are seeing the consequences of this in the neighborhood, in their communities. We need to stand up for this fight. We need to be on the side of mental health care. We need to be on the side of public health for all Chicagoans. Thank you.
Bravo.